Okay, good evening, everyone, or good afternoon. I'm Robin Toohey, Senior Director of Support Groups of the International Myeloma Foundation, and it's my pleasure to welcome you to tonight's Living Well webinar on nutrition. Tonight's program is part of the IMF's Living Well with Myeloma series, which is designed to cover all the important and most up-to-date information regarding myeloma to help you live well. I'd like to thank our sponsors for their support of this program, Celgene, Janssen, and Takeda Oncology. So it's now my pleasure to introduce tonight's speaker, Kylie Buchan. Kylie is a registered and licensed dietitian and holds a certified specialist in oncology nutrition designation. She currently works as an outpatient oncology dietitian for Savor Health, an oncology nutrition company providing nutrition consultations and personalized meal delivery to customers nationwide. She received her Bachelor's of Science in Clinical Dietetics from the University of Oklahoma in 2008. Kylie is passionate about educating oncology patients on the importance of nutrition during cancer and assisting them during all phases of treatment as well as survivorship. We're very pleased to have Kylie present on our call this evening and to also field your questions at the end of this presentation. Please remember, if you have a question, type it in the control box under questions. It's now my pleasure to turn the call over to Ms. Buchan.
All right, well, we're going to start, since we're starting a little bit late. The first slide is just about the importance, the overview of what we're doing. We're going to talk about the importance of nutrition, the management of treatment-related side effects, food safety, multiple myeloma complications, nutrition and survivorship, and then we'll have the question and answer at the end. So starting with importance of nutrition, why is nutrition important during treatment and after? Well, 60 to 70% of cancer patients suffer from malnutrition. 1/3 of all the cancer deaths are from malnutrition. So it's a very important aspect of it. Importance of nutrition is good. You maintain weight and body stores. Keeps your body built up and your immune system built up. Better tolerate your treatment-related side effects. The nausea, the diarrhea, the constipation. You do a lot better with that when you're fully hydrated and fully built up nutritionally. Lowers the risk of infection plus hospitalizations. It helps you heal and recover faster and a better quality of life. You have better intake, you have better quality of life. Research has shown that adequate nutrition can reduce the delays in treatment as well as hospitalizations. So there's a lot of benefit in that. Okay, so now we're caught back up with the slides. The nutrition goals during treatment: maintain body weight. You lose weight, then therefore you lose muscle mass. You want to keep that body built up as much as possible. Gradual weight loss, say like 1 to 2 pounds per week in overweight or obese individuals, is okay as long as that patient is eating adequate calories and protein. We just want to make sure our intake is enough. Another goal during treatment is adequate protein intake. So protein helps build that body up, helps with healing, helps with the immune system. So your protein sources, of course, are going to be your meats, your beans, your nuts, your eggs, your dairy products, soy, also those nutritional supplements, the protein bars, protein shakes, those types of things. So the goal of getting protein every time you're eating, that can help keep that body built up. Adequate hydration status, so making sure you're fully hydrated. At least 64 fluid ounces of water is the goal, or more if you're losing excess fluid through diarrhea or vomiting or excess sweating. Your fluid sources are going to be your water, of course, is the best, and then your 100% fruit juice, your tea, your vegetable juices, those types of things. Anything hydrating. If it has caffeine, you're kind of losing fluids through that. And then another goal through treatment: remain as physically active as possible. You don't want to overdo it. You just want to remain as active as you were before, and so you can get through treatment a little bit easier with that. So side effect management, you know, those side effects can occur, and a lot of times they're not adequately managed. It's important to let your physician know about those side effects, and not just thinking, oh, well, it's just treatment, it's just cancer, this is just what happens. There's medications, there's tips that you can use to help combat those side effects. A lot of times these physical side effects can lead to a delay in treatment or dosage of your treatment. So you want to make sure you stay on top of those. So the first one is decreased appetite. That's a lot of times what people associate with going through treatment. You know, your appetite's really poor. One of the major goals, and you'll hear a lot of times through this, is eating small meals often. You don't want to try to sit down to three meals a day, 2 meals a day, even if that's what you've done your whole life. You want to kind of switch over to the grazing method, eating every 2 to 3 hours, 5 to 6 times a day, and that way you can usually get in more nutrition than just trying to sit down to 3 meals. Drink your fluids in between meals. You don't want to sit down to lunch and have a big glass of water and then you're not hungry for anything that has some calories. So try to go more on a food, drink schedule in order to try to get the adequate calories in, but also stay hydrated as well. Physical activity prior to a meal, that could just be, you know, walking around the block, going out and checking your mail, doing something a little bit more active can help stimulate that appetite. Add extra calories to the food that you're eating. The goal is to maximize those small meals that you're eating. You're not eating a lot, so you need to pack as many calories as you can in that small amount of volume. So adding high calorie foods onto the things you're already eating. So you add olive oil, avocado, full fat coconut milk, switch to whole milk instead of skim milk. You know, making those little changes can make the difference in the calories that you're intaking. Take advantage of good days and times. So say breakfast is always a good time for you, you're feeling pretty good. Well, eat a bigger breakfast, or there's a week in between your chemo treatment that you're feeling pretty good. Take advantage of those good days and then try to just make up for it for those times when you're not feeling as good. And then medications to help increase the appetite. There are medications out there that you can talk to your physician about if you feel like you've tried some of these things and you've really worked on it and you know it's not getting any better. There's some medications that can help. A lot of those medications, they have to be in your system for a while for them to work. So you want to be on them for maybe a week, almost a week and a half before they start really kicking up your appetite. The next side effect we talked about is diarrhea. Very common with certain chemotherapies. Other chemotherapies, you don't really experience it. It just depends, and kind of depends on how your body adjusts to it. Major goal of diarrhea is adequate hydration. So your water, your broth, sports drinks. Pedialyte is a good one that is given to children usually, but it actually has less sugar than your normal sports drinks, but you're still getting those electrolytes. The major electrolytes that are usually lost are potassium and magnesium, so you want to make sure you're getting those with some sort of electrolyte drink. Following a low fiber and bland diet. You don't want to eat the high fiber whole wheat bread. You want to eat white bread, pasta. Follow the brat diet if you've heard that. Bananas, rice, applesauce, toast. That's all your bland, easy to tolerate, easy to digest foods. So stick with that type of food. Stay away from anything spicy, fried, or creamy, anything that can be too heavy for your digestive system. Avoid caffeine or added sugar. Those things will both stimulate your gut, get things moving faster. When you have diarrhea, you don't need that. So avoid the caffeine. Also, alcohol is another one to avoid as well because of that. Also, with the added sugar, stay away from fruit juices. Some people think that's good for the diarrhea. Well, that high amount of sugar will make the diarrhea worse. And you can speak with your physician regarding antidiarrheal medication regimens. There's some that most of them they use are over the counter, but there are still some that are prescription strength, and you have to stay on a pretty regimented schedule in order for it to really get a hold of it. So you just kind of have to stay on top of that. Constipation, swinging on the other side, it can be caused from certain chemotherapies, but a lot of times it's caused from other medications. Pain medications are a major one. Also can be caused from dehydration. So again, adequate nutrition is one of the big goals here. Doing those hydrating fluids like we talked about. On this side, you want to increase the fiber intake. So that whole wheat bread, the brown rice, your fruits and vegetables, all of those are going to help with the constipation as long as you're getting adequate fluid. If you're eating fiber and not getting the adequate fluid, it's not going to do any good for the constipation. Physical activity as well. The more you're moving, the more it's going to help your bowels move as well. Some foods that will help constipation: prunes or raisins, also prune juice, of course, if you've heard. Black cherry juice is another one that works the same as prune juice, but in my experience tastes a little bit better, so that might be one to try. Senna tea. Senna is in a stool softener, usually in a stool softener form, but certain teas are made that that senna leaf is in the tea bag, and so that can help stimulate the digestive system and get things moving. You can find senna teas in your normal grocery stores, just in the tea section. And another time, speak with your physician regarding a bowel program. There's stool softeners, there's laxatives, there's a lot of different options out there, so you just need to talk to your physician and kind of get on a good schedule. Nausea and vomiting, also common through any kind of cancer treatment that you're having. Sometimes you're nauseous when your stomach is empty. A lot of patients don't realize that. They're nauseous, so they're not eating, and it's kind of a snowball effect. So aiming to eat every 2 hours or more can actually help prevent the nausea from coming on, but it also might settle the stomach as well. So stick again with your bland, cold, or room temperature foods. You don't want to do hot foods when you're nauseous. Hot foods smell, and a smell is a lot of times what can trigger that nausea. So the colder room temperature foods don't smell, so stick with those. Same with the bland foods. Like I said, nothing fried, nothing rich, creamy, anything like that. Stick with loose fitting clothing. You don't want anything on your stomach that can make it worse. Foods that could help with the nausea: ginger is one. They make ginger candies out there that are made for nausea, and those can help quite a bit. Ginger ale, ginger tea is another good one that can kind of help settle the stomach. Same with peppermint tea, or little peppermint candies might help do the job. And take your antiemetics as prescribed. Some people take them just when they get nauseous. Well, that could be too late. You can stay on a schedule with them. Some you can take every 8 hours, some you can take every 4 to 6 hours, and then that'll take care of it and actually prevent the nausea from coming on. So talk to your physician about that, different antiemetics, because there are a lot out there and they work in different ways, so you can actually take a couple at a time without interfering or anything. Taste issues. Sometimes it's a metallic taste, sometimes it's a no taste, sometimes it's just not a very pleasant taste. You get all sorts of different things there. If you have metallic taste, use plasticware instead of silverware. Don't put anything metal up to your mouth. So even trying to avoid metal pots and pans is a good idea, although it's very tricky. But using glass, ceramic whenever you can may help prevent that transfer of the metallic taste. Tart foods and candies. So lemon drops, Jolly Ranchers, anything kind of tart can kind of help get the salivary glands working and clean the mouth out. Rinse your mouth out before meals. Sometimes just water with lemon can help, or you can do kind of a baking soda and salt swish and spit. That works pretty well, balancing out the pH of the mouth, make things taste a little bit fresher. The recipe for that, if you don't know it, is 1 teaspoon of baking soda, half a teaspoon of salt, and with a quart of water. You can just mix that up. It it stays fresh for a long time, so you can make a big batch of it and just rinse your mouth out before eating, just to make things, help things taste a little bit better. Adding distinct flavors and marinades onto things. So a lot of patients will tell me that spicy foods are really good right now, or pickles are really good. These really strong, distinct flavors, where if you can't pick up on anything else, any bland foods, at least you can pick up on these strong flavors. Marinating in some type of vinegar base, like a vinaigrette, can sometimes help kind of boost that flavor a little bit. So maintain the adequate nutrition during treatment by eating small meals or snacks frequently. I told you I'd be mentioning that a lot. Every 2 to 3 hours is the goal, to kind of keep that body built up and keep your mind getting hungry, triggering that stomach to get hungry. Treating food like medicine. You take your medicine every day, every 2 hours, 3 hours, 4 hours, whatever it is. You need to do the same with food. It's just changing your mindset, whereas now you have to eat instead of just wanting to eat. Staying on top of those side effects, really kind of get a grasp on any of these side effects that you're having, to really try to prevent any type of malnutrition. Asking for help from family, friends, in the community. There's a lot of people want to help bring a meal or do grocery shopping. Take advantage of that. Also, community resources. Go to your social worker at your local hospital, and she'll probably have a good list of different community resources that can help with meals, or help with transportation, a lot of different things that is needed for oncology patients. And cooking in bulk when you're feeling good. So that day after chemo, a lot of times you're still feeling pretty good. Make a big pot of soup, a big freezer lasagna, something like that, to keep on hand for when you don't have a lot of energy to cook those next few days. Speaking of energy, fatigue is very common with chemo, but also with radiation. Again, small frequent meals, that's kind of the theme. Eating more often can help provide the body with energy. So anytime you eat, your body burns that energy and you get a little boost there. Reduce your intake of sweets and sugar. High sugar foods can actually cause more fatigue because it raises those blood sugars and then it drops them. So trying to eat foods with more protein in them can help decrease the fatigue, or help kind of give you a little bit of more energy. Be active. Small bouts of activity can help kind of get your body moving a little bit, get your fatigue resolved. Get adequate rest, of course, and then talk with your doctor about any stress or feelings of depression. Also, that social worker might be a good resource for that too. Low blood counts. So the low blood counts we're talking about are the white blood cells, the red blood cells, the platelets. Those are commonly can be low with multiple myeloma. Neutropenia is where white blood cells are low. That's very common. Also with the immunotherapy as well. One of the things for nutrition to do is just having a well-balanced diet, keeping adequate nutrition, adequate intake, adequate protein intake as well. Like I said, that's very important for all treatments, but of course when your blood counts are low, that can help boost you up a little bit. Food safety is very important when you're neutropenic, when you have low white blood cells or neutrophils. When you're neutropenic, you're at a much higher risk of infection, so you want to practice good food safety skills in order to prevent infections or hospitalizations. So food safety, wash your hands as often as possible. It's the best way to prevent the spread of germs and prevent infections. You want to wash your hands before and after eating. You want to do it after touching raw meat, seafood, eggs. Really, anytime there's a question, you need to wash your hands. For those undergoing stem cell transplant, there are more extensive guidelines that your hospital or clinic will give you. Everyone's a little bit different, so it's going to be somewhat strict, just to make sure that you're playing it safe and since you're at a much higher risk for infection at that point. So with food safety, keep your raw foods separate from your prepared foods. That's when shopping, storing, using cutting boards. Use disposable paper towels for cleaning and drying your hands, which can help decrease exposure to bacteria. Always thaw or marinate your meats in the refrigerator, not on the counter. I always get that from my grandma, that she always left it on the counter. Refrigerate or freeze leftovers within an hour, and cook all your meat and eggs thoroughly. And that's especially like even with steak, with eggs, make sure everything is well done during that time when you're neutropenic. When you're neutropenic, especially, avoid these foods on here: the raw dairy products, unpasteurized dairy products, moldy and soft cheeses, unwashed fruits and vegetables. I recommend a vinegar wash that you can use for all your fruits and vegetables. It's really just half a cup of white vinegar to a quart of water. You just fill your sink up, let your fruits and vegetables soak for a few minutes, 3 to 5 minutes, scrub them, and then rinse them off. That can get rid of the mold spores. It can get rid of the pesticides, the bacteria, all that junk that's on your fruits and vegetables from the grocery store. When you're eating out, however, I would avoid raw fruits and vegetables for that reason. We don't know how they're prepared, how they're cooked. When you're at home, raw fruits and vegetables are fine because you know that you washed them well. With that, buffets, salad bars, and deli counters are also ones to avoid, just because we don't know what's going on in the back or under the sneeze guard or anything like that. To play it safe, we want to avoid any extra exposure to that bacteria. And then your raw nuts, honey, and all of these other raw foods, much higher risk of bacteria. So these multiple myeloma complications, these are not necessarily from treatment or treatment related. They can occur in patients from the actual disease, from the actual multiple myeloma. The first one's anemia. There's different types of anemia: bone loss, hypercalcemia, which is high amount of calcium in your blood, renal issues, so some kidney insufficiency, and then hyperglycemia, which is high blood sugars. So first, the anemia. It's caused by the multiple myeloma, not usually because of a nutritional deficiency. Your physician will be able to tell you the exact type of anemia, and if there are adjustments to your diet that you can make that can make an impact. With anemia, usually some blood transfusions come along with that. So you want to be cautious with iron supplements because they can cause an iron overload. Iron is given when you get a blood transfusion, so it could be too much for your system. If it is iron deficiency anemia, you can try to increase the iron in your diet. The high iron foods are kind of broken down into two different sections. There's plant-based, which is called non-heme iron, and there's animal-based, which is heme iron. The animal-based are in your meat products. Those are much easily absorbed over your plant-based, which are your leafy greens, your nuts, your beans, some dried fruit. A lot of your cereals are fortified with iron. So you're going to get more iron out of the animal-based than you will out of the plant-based. If you're eating the plant-based foods to get the iron, you need to pair it with some vitamin C. The vitamin C helps increase that absorption. So say you're having a spinach salad, you want to get that iron from it, put some tomatoes on it, use some type of vinaigrette or some orange juice in the dressing, something like that to try to get that iron out of there. Avoid calcium supplementation with iron deficiency anemia because the calcium can interfere with the iron absorption. Also, tea has something called tannins in them, and if you drink tea while you're eating iron-rich foods, you won't get that iron. It will interfere with the iron absorption. So try to avoid those two things. Tea is fine, not with meals, but not during. Bone loss and bone pain is common in patients with multiple myeloma. For the nutrition side, a well-balanced diet, your whole grains, your lean meats, your fruits and vegetables, your low-fat dairy, those are all good choices for that well-balanced diet. Your calcium, vitamin D, magnesium, and vitamin K, those are all vitamins and minerals that are needed to prevent further bone loss. Your high magnesium foods are going to be your greens, your nuts, your beans, your fish. Same with your vitamin K. It's mostly those leafy green vegetables. So getting those vitamins, minerals from food is a good way to help with that bone loss. The bisphosphonates, those can help slow the advancement of bone disease and reduce the risk of fractures and bone pain. So Zometa is one of those that you may be familiar with. You also want to make sure that you are taking calcium and vitamin D supplementation while you're on the Zometa. Weight-bearing exercise is helpful for bone loss, can help strengthen your bones. Avoiding smoking and alcohol, that will exacerbate the bone loss. And there's also low-dose radiation, something to talk to your physician about, may also help reduce bone pain if it becomes unbearable. Hypercalcemia. So multiple myeloma associated with bone breakdown, which causes that excess calcium in the blood. So that's why that hypercalcemia is pretty common in multiple myeloma. So you have the bone loss, so that calcium is coming from the bone loss to the bloodstream. So your dietary calcium intake doesn't need to be restricted. What you eat won't affect the amount of calcium in your blood. Supplements, however, can, because if you're taking a larger dose of them. So any type of supplements, also antacids such as Tums, can have a good amount of calcium in them, and they can cause a calcium overload. So just tell your physician about any of those over-the-counter meds that you're taking. Adequate hydration, you want to be fully hydrated because it will help flush everything out, things that aren't supposed to be in there. If you're dehydrated, that'll cause the calcium in your blood to be even higher. Kidney health. The multiple myeloma could also cause problems with your kidney function from that higher calcium levels in your blood. So it's all kind of connected. The bone loss causes a hypercalcemia, which could then cause the kidney problems. Calcium in the blood decreases is hard for the kidneys to filter. So that's where that comes from. So generally well-balanced diet, again, those lean meats, the whole grains, the fruits and vegetables, adequate fluids. Again, we want to make sure we're hydrated so the kidneys can filter through that blood. Limit your sodium intake to less than 2,000 milligram per day, which is a low sodium diet. High sodium intake can be difficult for the kidneys to tolerate, so you want to make it as easy on your kidneys as possible, since there's some things working against it. Protein needs are one that are variable based on the renal labs, based on the clinical picture. Sometimes some of them need higher protein, sometimes you'll need lower. So it'll just depend on kind of what's going on, and that's something to talk to your physician or your local dietitian about. Hyperglycemia, this is usually caused from the steroids that you would take, the dexamethasone that you would take with your treatments. Steroids are known to increase those blood sugars. So nutrition-wise, the goal, achieve and maintain healthy body weight. When your body mass is higher, your blood sugar is higher. It's harder for your insulin to bring your blood sugars down. So having a lower body weight can help decrease the blood sugars. Same with your physical activity. Restrict your intake of sweetened beverages, which is pretty obvious. Stick mostly with your water. Decrease amount of those simple sugars. Complex carbohydrates, those are going to be what you want to choose with the hyperglycemia. So again, the whole wheat, the brown rice, the whole wheat pasta, those you're going to those are going to have fiber in them. Fiber can help decrease the blood sugars, protein as well will do the same. So when you're eating, you want to do complex carbohydrates with the lean protein source, and that can decrease those blood sugars as best as possible. Your fish, your poultry, your soy, those are going to be some of the best lean proteins. So dietary supplements, you always want to check with your physician regarding any type of supplement use. Some of them may interact with your treatment. Some will make your treatment less effective. So anything that you're taking, you definitely want to bring to the attention to your medical oncologist. One of the chemotherapies that's pretty common with multiple myeloma is Velcade, and that can have an interaction with both green tea and vitamin C. With green tea, you need to avoid green tea on the day of treatment. Any other time, you don't want to drink a lot of it, but every once in a while, some green tea is fine, just not on the day of treatment. You want to, however, avoid any type of supplements of the green tea or of the EGCG, which is the compound in the green tea. That's going to be a more concentrated dose, and it will affect the Velcade's efficacy. Vitamin C also can interfere with the Velcade. You don't need to reduce your intake from food, but it's not recommended to take a supplement either. So that's one to also keep note of. So going to survivorship, patients diagnosed with multiple myeloma are living longer with the advent of these new therapies. Following a well-balanced diet can help with the prevention of other medical issues, of heart disease, diabetes. It can also help prevent certain types of cancer. So different goals with that: maintaining a healthy body weight. There's a lot of research that says a higher body weight, a higher body mass index, is linked to all these things that I mentioned, including different types of cancer. Adopting a physically active lifestyle, which will help to maintain that healthy body weight. Eat whole foods, limit the processed foods. So your fruits and vegetables, the goal is to eat 5 to 9 per day, and also variety. You don't want to just eat apples and carrots. You want to eat a variety of different fruits and vegetables to get those variety of different antioxidants. Whole grains, so your whole wheat bread, your quinoa, your barley, those whole grains are going to be a great source of protein, but also a good source of fiber. Limit your red meat, your beef, pork, and lamb. The goal is less than 18 ounces per week. That's just because there's a lot of strong link between red meat and certain types of cancer, including specifically colon cancer. Limit processed meats, the same thing. Strong link to certain types of cancer. With these, it's best to just avoid as much as possible. Strive for at least 2 servings a week of fatty fish. So your salmon, your tuna, your mackerel, those higher fat fishes are going to get those omega-3s, which are great for your heart, great to prevent inflammation, great to help with brain function, just a lot of benefit with those omega-3s. If you drink alcohol, limit the consumption. So no more than 1 drink per day for women or 2 drinks per day for men. So one of the goals maybe is to follow a Mediterranean diet. So that's more of your whole grains, your fruits and vegetables, nuts, olive oil, fatty fish, all these things that I mentioned up here. A less amount of meat, but you're going to get a lot more antioxidants, more benefit from that. So this is what is called the New American Plate. It comes from AICR, which stands for the American Institute for Cancer Research. Their goal, actually who they are, is they're kind of a government entity that all they study is nutrition and cancer. On the end of my presentation, there's a reference guide and it has their website on there. They recommend to follow a diet of 2/3 plant-based, 1/3 animal-based. So this is kind of an example of how a plate could look with the New American Plate. You have your plant-based foods with that small amount of animal base. You don't have to go completely vegetarian, but you're getting more of the good benefit from the plant-based. Your plant-based proteins are essential in this, so your beans, your nuts, your nut butters like your peanut butter, almond butter, and soy. So that's a good way to get protein without getting the animal-based protein. So putting this into practice, how do you do this? First of all, make half of your plate non-starchy vegetables. Going back to that new American plate, that's a good way to measure. You don't have to count anything. You can just look at your plate, and that's a good way, a good starting point. Shop on the perimeter of the grocery store. So that's mostly where your produce, your lean meats, your low-fat dairy, all your less processed foods, your real whole foods are going to be in that area. Include one colorful fruit or vegetable in each meal daily, and try different fruits and vegetables. There's so many benefits to a variety of fruits and vegetables, so having more variety is the goal there. Eliminate one sweetened beverage and replace it with water, and the goal eventually is to replace all of your sweetened beverages with water as much as possible. Strive to keep meat portions to 1/4 of your plate, going back to that new American plate. It's an easy way to look at it. You don't have to measure. It's just a good eyeball. And try a new whole grain. There's so many whole grains out there that most people don't know about. There's quinoa, there's barley, there's farro, wheat berries. There's all different types of whole grains that'll give you more variety, more fiber, and give you some plant-based protein. And try to make one vegetarian dinner per week. It's a good goal to have a meatless Monday, to really try to get more of those plant-based proteins in. So with physical activity, also very important for the survivorship. It can help, like I said, with the diet, it can also help prevent heart disease, diabetes, and some other malignancies, just like the healthy diet would. So discuss it with your physician. Make sure it's an okay time to increase your physical activity. Strive for 30 minutes at least 5 days a week. Don't go out too strong. If you're starting from scratch, start with 5 minutes, 10 minutes, and go from there. There's actually research that says breaking up your exercise into 10-minute increments a few times a day can help you burn more calories and get more energy than just doing a whole 30-minute stint at one time. So that's always an option, to break it up throughout the day. And 2 times per week, aim for the stretching and the strength training. Strength training, of course, is very important for your bone health. So putting it into practice, find an exercise buddy for that accountability. That's what's very important to keep you motivated. Find a friend. There's apps nowadays that have a lot of different ways to motivate you. So look for something like that to really kind of get you excited and get you motivated. If you're sitting down for an hour, try to walk for 10 minutes every hour. So that way you're being active and doing what you can to help get that body moving and burn some calories. Find a fun physical activity that you enjoy. Pretty self-explanatory. You want to do something that you like doing instead of just making yourself do something that you won't stick with. If you're limited or confined to a bed, talk to your physician about doing physical therapy. There's so much benefit to physical therapy. Increase the strength, increase your immune system, less hospitalizations. So that's really an important aspect for everyone. And here's a smoothie recipe. It comes from our cookbook that was released last year. Smoothies are a great option for those undergoing treatment, because there's a lot of ways to add those extra calories in, but also is good for survivorship. As long as it's whole foods, as long as you're getting some fruits and vegetables, some protein, you're getting benefit from it. So with this one, having your both fruits and vegetables in a smoothie is important, because you can really pack in the nutrition there. You get a good source of protein, with the dates in there, you can't really even taste that they're there, but you get an extra amount of fiber, potassium, magnesium, those electrolytes that are very important during treatment and after. So some references. The first one, of course, is the International Myeloma Foundation. They have a lot of very interesting nutrition articles and videos to look at. I found them very informative, so it's something to check out. The American Institute for Cancer Research, I mentioned that with the New American Plate. They have a lot of recipes, and anytime there's new research that comes out regarding nutrition and cancer, it's on there. And of course, the American Cancer Society. And then here's just some general information. The NCI, National Cancer Institute, the Academy of Nutrition and Dietetics, that's the dietitians group, have a lot of good articles on there. If you're looking for a CSO, which is a certified specialist in oncology, which is a dietitian that has gone through training, has taken a test, has gone through a certain amount of hours, you can look on this website, the oncologynutrition.org, and find a CSO in your area. And then Savor Health, that's who we work with, and we do custom meal planning, meal delivery for oncology patients. I think we're ready for questions.
So thank you, Kylie. That I found very, very informative and helpful, and I've been monitoring the questions that have been coming in, and they've been very, very good. Right before we go into those, I just wanted to answer a general question that had been coming in quite often. Some people are looking how they can access and download the slides. So if you go to myeloma.org, myeloma.org, and you scroll down a little bit till you get to the section where you see News, N-E-W-S, on the lower left of the home page. Click on News where you see Kylie's photo and the nutrition information, and then right there is where you'll be able to download the slides for tonight's call. And also, some of you were wondering if we're recording this call, and the answer is yes, we are. And so that recall and replay will be available early next week. So again, just go to myeloma.org and you can replay this. So now I'd like to go on to some of your questions that have been coming in. And we did have a couple questions saying, Kylie, would you please let us know what the measurements were again when you were talking about washing the fruits and vegetables with that vinegar mixture? What was the measurement between of the water to the vinegar?
It is half a cup of white vinegar to a quart of water.
Okay.
So you can just, I do it in my sink, so it's easy just to fill it up in the sink or in a big tub and get them from the grocery store and throw it all in there. Just let it soak for a couple minutes. Don't soak it too long because some of the fruits and vegetables, it can kind of turn them mushy. But scrub them, rinse them off, and that can kind of help get rid of some of that extra bacteria in there.
Yeah, that's a great tip, especially for those patients with low immune systems or after transplant or depending on the treatment they're on or actually the myeloma itself. So that's a great tip. So now I've got another question from Adina, and Adina is asking, what about people with kidney damage but not on dialysis who are trying not to eat a lot of protein? She says she's been told that protein can put a strain on the kidneys.
Yes, that is very true. And you want to do some protein. You don't want to go without protein, but that's maybe where you're doing more of your plant-based proteins. So your nuts, your beans, peanut butter, you're getting some protein in there, but you're not getting too much where it will stress out your kidneys. Some people need extra protein with their renal issues. Some people, like you, need less. So it's just talking to your physician about that goal and what your needs are. But the more plant-based proteins, you can still eat protein, but it just won't be as hard on your kidneys.
Okay, great. Okay, the next question is from Eleanor, and she's saying, when taking steroid medication, how do you balance diabetes as it raises blood sugar?
That is tough. It's very tough. Eating often can help. Eating often and eating protein at all of your little meals can help kind of stabilize your blood sugars. Not kind of it'll help prevent the strong ups and downs. So still eating some carbohydrates, but protein every time you're eating and often can help keep you stabilized. Fluids too, making sure you're hydrated, can help kind of decrease those blood sugars a little bit as well.
Okay, great. And then, of course, always discussing that too with making sure all of your doctors know if your myeloma treatment includes steroids like dexamethasone, then all of your doctors should know that you are now on this so they understand how to best treat each patient. Okay, next question comes from Fred, and he asks, have you ever found that a low or gluten-free diet helps with bowel issues?
You know, I haven't heard that. I guess if you have some type of gluten insufficiency or gluten intolerance, then that would definitely be the case. Every gluten's hard on your digestive system, so I could see that. It would be less fiber, which sometimes is easier on your digestive system. But I think that all depends on you and how your body reacts to gluten, which
Okay,
unfortunately is one of those that everyone's different is with that.
right. Yeah, it's getting more and more common, I guess. So next question is from Sam, and he's asking, is whole wheat usually better than 9 grain?
As long as it is whole wheat, it's the same as a 9 grain is great. It really is up to personal preference as long as you're getting um, a whole product with the whole grain in it, including a 9 grain. If it just says a wheat bread, that doesn't really tell us anything. So any of those that are whole wheat, whole grain, 9 grain, all of those are going to be have a lot of protein and have a lot of that fiber in it. So any of those will work out just as well.
So Kylie, I'm getting a question here to please go back to the reference slides again. People want
Okay.
to jot that information down. And also, folks, these slides again, if you go on your computer and you go to myeloma.org, scroll down under news until you see the information on the nutrition webinar. Once you click on that, you'll see a red button that says click here to download the slides. So you'll then be able to have all these slides written right out for you. You can print them, download them, and hold on to them. And of course, like I just mentioned, we will have the replay of this available probably by next week. Okay, so I have a question here from John, and he's asking, are there fruits and vegetables that are rich in calcium?
Your leafy greens will be high in calcium. Broccoli is another one. So those are kind of your main ones. A lot of your cruciferous, like your broccoli, cauliflower, cabbage, those are going to have some calcium in there in those leafy greens. So those are the best ones for you with the calcium.
Okay, great. This is an interesting one, and I have heard this a little bit more mentioned. Perry is asking the question about bone marrow soup. There's been a lot about that lately. Do you have any thoughts on that, Kylie?
I don't. I don't know much about bone marrow soup. Um, do we know what is it to help, just I guess to help build up the bone marrows? Bone marrow, is that what the
I'm not really sure. So I think the best thing to do is call the IMF's info line, and that's 1-800-452-2873, and they could research that a little bit for you. I'm sure they'd be happy to look into that. Another question that has come up a couple of times now, I've seen a few questions on this, is the ketogenic diet. I guess many doctors are recommending this versus those thriving on a higher carb diet versus the Mediterranean diet. Any thoughts on that?
Yeah, I think that a ketogenic diet still gives you that good amount of protein. It's very low carb. It is higher in fat though than some of the other ones. There's some research out there that can go both ways. That there's some benefit to the ketogenic diet for certain diagnosis and some downfalls to the other. But it's pretty similar to not really to the Mediterranean in the meat wise, but doing more of your whole foods, less processed. It's similar in that area, but the ketogenic is, like I said, a lot more protein and very high in fat, which is appropriate for some, but also may not be appropriate for other people with maybe some heart issues or diabetes or anything like that could affect that as well.
Yeah, so just kind of like myeloma, it's very individual. So how important is it that we continue to have good conversations with our own doctors and nurses so we know individually what might be best for us? Okay,
Exactly.
so another one, of course, is related to steroids. With myeloma patients, it's always the good, the bad, the ugly of steroids and dexamethasone. So this question comes from Kim, and she's wondering if you have any suggestions for dealing with steroid-related weight gain or puffiness.
That is tough because it is very common. Watch your sodium intake because that can cause fluid retention for some of that puffiness. With the steroid-induced weight gain, maybe following kind of like we talked about the New American Plate. You're still getting protein in there, but you're getting more of the fruits and vegetables that have less calories. Eating more often, like I talked about many times. The more often you eat, it helps your metabolism burn a little bit better. So sticking with more of a plant-based diet, more of your fruits and vegetables, you would stay full but get less calories. That would probably be the best route to go. And then the low sodium for some of the fluid retention, the puffiness there.
Okay, all right. I see that it's 8 o'clock, and I want to be conscientious and respectful to everyone's time. So I think we'll do one more question, and then we'll wrap this up and thank everyone. So I have a question from Bonnie, and she's wanting to talk about what is known based on empirical evidence about curcumin, and then she asks about type and dose. Any thoughts on that, Kylie?
With the curcumin, it's shown to be very good, very healthy, low. It helps with inflammation. It's very high in antioxidants. Dosage wise, that would be something to talk to your physician about because it is so high in antioxidants. You don't want it to interfere with any treatment or medications that you're on. But adding it into the food you're eating. Same with turmeric is another one that's really important. Same family as the curcumin. You can make a tea out of it, so you're getting some of that benefit. But the supplement wise, I would definitely err on the side of safety and speak with your physician about the appropriateness with treatment and that.
All right, that's absolutely good advice. So for those of you that had additional questions that we did not have time to address tonight, I highly encourage you to call the IMF's info line. Paul, Judy, and Missy are more than happy to talk with you and research your questions. The info line phone number is 800-452-2873. And they are available to take your calls Monday through Thursday from 9 a.m. to 4 p.m. Pacific. And on Friday, it's 9 a.m. to 2 p.m. Pacific. So thank you, Kylie, so much for taking your time this evening to help us better understand nutrition. And I'd also like to give everyone a few reminders about some important things you might want to mark on your calendars. There are 3 regional community workshops happening in June. Edina, Minnesota is June 10th. Buffalo, New York is on June 17th. Dearborn, Michigan is on June 24th. And these regional community workshops are free programs bringing in myeloma experts and a member of the IMF's Nurse Leadership Board in to talk with the community about all the updates you need to know about myeloma. And I think that we also want to always be very thankful of our sponsors for tonight's call. And again, that's Janssen, Celgene, and Takeda Oncology. And most importantly, thanks to all of you tonight on the call. I hope this was helpful to you. And Kylie, we really thank you for all your additional information and care for the myeloma community. I hope you all have a wonderful evening. That concludes our program for tonight. Thank you.